Introducing ProActive, a smartphone app capable of first identifying vulnerable populations to COVID-19 and then connecting them with the appropriate resources in order to reduce the overall deaths and mitigate diffusion of COVID-19 in these vulnerable populations. Now, currently, COVID-19 has affected millions of people on the globe, and this number, researchers say, is a fourth of the actual population that's probably affected or has transmitted COVID-19. Vulnerable populations, especially, have a higher chance of contracting the disease, and as you can see here, ages 60 plus just have higher fatality rates to COVID-19. And the disease, if one person has it, then it can be contracted to 2.5 people, which is approximately twice the contagious rate of the flu. Now, there's 8 out of 10 deaths in adults who are 65 years and older. So if these populations are not identified, cases will just continue to grow drastically. Not only will adults die from the disease, but they'll also spread the disease to other people. Based on this, the goal of this application is to address health and vulnerable population concerns. So the health portion of this application addresses a scale of health initiatives, including providing preventative and hygiene behaviors, especially for these at-risk regions and countries and populations. Also, telemedicine will be scaled and containment strategies will be implemented. Now, vulnerable populations will be identified through health, economic, and social characteristics in order to mitigate this COVID-19 outbreak. Now, the people who need extra precautions health-wise are older adults and people who have this serious underlying medical conditions, and they are at higher risk for COVID-19 according to the CDC. And these are just some of the characteristics, some of the diagnosis factors which are present in these old people, which make them vulnerable to COVID-19. And just in the 2015, according to the census.gov, there's 47.8 million people who are 65 and older in the United States. Now, this number is drastically greater today, which is why we need to address the vulnerable population concern. Introducing remote telemedicine. So what I did is I developed a PPG telemedicine tool that uses the front and rear end cameras of the smartphone in order to extract vitals such as the heart rate and the blood pressure. Now, these two vitals can be used to extract other vitals as well, such as the upper limit of the QTCB interval, the QR interval, and the RMSSD for heart rate variability, or the HRV. Now, here's the process. So basically, a camera frame captures a certain recording of the finger, and then certain image segmentation and processing techniques are applied here. And then based on this, machine learning image segmentation is applied and then hue extraction and automatic outlier removal is applied in order to sort of, here you can see, detect some of peak frequencies and pulse peaks in order to identify blood pressure correlation, RMSSD, HRV, and calculate the QTCB. And based on this, a diagnostic system is proposed. Based on these characteristics, certain scores are assigned for gender, physical activity, and all these characteristics above. And once summed, if the score is greater than a certain amount, then this is what identifies a vulnerable population, and extreme risk and high risk patients will be prioritized more than potential and low risk. So people who need extra precautions depending on the social and economic factors. So this is a map that identifies people, vulnerable populations in certain regions of the United States who are more vulnerable to the disease depending on social and economic characteristics. Now, what the smartphone app does is, based on the region of the user, the app prompts the user first for their region, and then based on this region, it can advise the user in order to take certain precautions that would be, and connect them to resources. So first, it identifies if you're at high risk, and then it gives these sort of recommendations, and then you can also schedule a test, request a test at a center nearby if the vulnerable population case exists.